Successful laryngoscopy requires creating a view from the mouth to the cords. An understanding of oral and pharyngeal axes is essential for both positioning and intubation. Barish's clinical anesthesia simplifies the airway into two axes. The oral axis represents the average path through the mouth. The pharyngeal axis represents the airway below the tongue. In this picture, the angles are almost 90 degrees apart. To intubate this patient, you would first need to displace a large amount of tissue in an anterior and caudal direction. Then you would need a severely angled endotracheal tube. When observing people intubating in these conditions, you'll frequently hear the clinician say, "I can see the cords, but the tube won't pass." Let's give our picture neck extension. The oral and pharyngeal axes are now much more aligned. Visualizing the cords requires less tissue displacement. This means less force with the blade and reduced tissue trauma. Also, the endotracheal tube will pass with a slight bend or no stylet at all. When intubating, optimize head and neck position within the constraints of your clinical situation. Anesthesia providers frequently use the term sniffing position. The sniffing position describes a person extending their neck to identify a smell. The sniffing position brings the airway axes closer to alignment and greatly increases intubation success. To achieve the sniffing position without hurting our patients, we strategically position bath blankets. The patient in this commonly used picture would be quite challenging without the ramp of support. However, with proper positioning, her airway should not be difficult. To see the cords requires displacement of the tongue and soft tissue. A very common newbie mistake is to lift upward. Lifting upward only works on the easiest of airways. Joust rather than lift. The force should be upward somewhat, but also towards the patient's feet at a low angle. To effectively intubate, position in a way that aligns the axes. Then, with either a straight or curved blade, joust with a vector of force similar to the arrows shown here.